Hi, this is Zach Kulsrud for Apex 360, and today we are in New York at the Greater New York Dental Meeting, and I'm joined today by Stephen Swanick, who is the CEO and founder of PeriRx LLC. How are you doing today?
I'm doing fantastic, Zach. How are you doing?
Good.
Thanks for having me today.
Well, it's a pleasure to be here. How's your show been going?
It's been phenomenal.
Good.
For a Sunday, the turnout's outstanding.
Good.
Yeah, we've been here many years as observers.
Right.
You know, really doing a lot of intelligent work and looking at the marketplace. So this is actually our eighth meeting.
Eighth meeting, okay.
Yeah, but our first with an actual product.
Right. And so we've got a lot to talk about, but before we get to the product, tell people a little bit about your company, PeriRx, where you're from, employees, who's in charge, things like that.
I'm in charge. Just kidding. I actually founded a company in Philadelphia, and the name of the company, PeriRx, we named it after the pericardium. The pericardium is the thin tissue sac which surrounds the heart. And so we use that as kind of a metaphor for, you know, preventative care and wellness and things like that. I thought that was a pretty cool name. So that's how we got the name. I founded the company in 2008, myself. I actually founded it in my basement. I'm not kidding you. I still have an office there. We have a much larger one now, but when I don't go into the office, I still use that. And we're over 10 employees now, and we're getting ready to launch our first test. Okay, so you've got a new product to tell us about today, which is very exciting because it's been in development for a while. It has,
so
yeah.
Let's talk about it. What do you have here?
Well, what we have, Zach, is a test. It's a diagnostic test for the early diagnosis of the 6th leading cancer in the world. And that cancer is oral squamous cell carcinoma for oral cancer. And so this technology actually emanates from over 10 years of backing and support of the NIH and the NIDCR. The early discovery work was done at UCLA, and I purchased all the intellectual property rights from them back in 2010. So we have actually over 800 patients in clinical trials with this product.
Right.
What's amazing about this test is its accuracy and its reliability. It's 96% sensitivity and 60% specificity.
So a lot of people have come by and wanted to know, how is this product different than the others out there? But you told me off camera that there really is nothing like this.
Actually, there isn't. I think what we did here is we literally created an entire new segment for not just oral cancer testing, but for other testing as well.
Right.
We do have a lung cancer clinical trial going on right now as well in Michigan. So when we did this, we knew that a multi-marker molecular panel would be much more discriminatory.
Right.
All right, and it would give the practitioner like an actionable item. Instead of just saying, well, you know, Zach, you may have a 2% risk of periodontal disease, our actual test will say, you've got something and you need to act upon that. So that is the big clinical difference, and that's what practitioners want. Right. Yeah.
So why did you choose to roll out the product here at the New York meeting as opposed to any other meetings?
You know, a lot has to do with timing. You know, we just finished up in late fall with our clinical trials. And right now we're actually running some quality control cycles with our test. And so I know it might be a little bit early, but you know, we feel that strongly that, you know, if we wanted to make a statement, New York would be a wonderful place for us to come up here and really make a statement. And it's actually surpassed our expectations. The reception has been unbelievable from the dentists, the physicians that are here, the hygienists, the nurses, and some just regular lay people who are here, family members.
Right.
It's been amazing. It really has.
So let's talk price point and then timing. So what's the price point for this, and when can we expect to see it in dentist's office?
The price for everything, including the kit, the testing equipment that is in here, the actual PCR, the actual test that we run it through, the professional reading, the test report, all of that. It only costs $165 for a cancer test that we can actually test. We can actually find people in stage 1 2, 3, and 4, we can actually test dysplasia, Zach. Zach, that means that we can actually identify patients in pre-cancer and stop it.
Yeah.
And stop it.
It's incredible.
It is incredible. I'm very excited about it, but that's what it does. It's amazing. It's an extremely simple and easy test to use, too.
And when can we expect to see it in offices?
What we're doing right now is when you do something like this, we are running, it's called bootstrap testing. You have to run it about 10,000 times. Right? And so what you're trying to prove to the regulatory agencies around the country is that it's very consistent, it's very accurate, and so that when you use it the first test, it's the same accuracy statistically as the 10,000th time you used it. So that's what you have to go through when you do something like that, and that's what we're doing right now. I think we should be finished that process by the end of the year.
Great. And is there anything else you want people to know about Salmark that they don't already know?
I would absolutely encourage them to go to our website. I would welcome all of their questions and their feedback, anything at all. This is a test that will save lives. In our clinical trial, 71% of our patients were in stage 1, stage 2. The average American diagnosis is stage 4, and you barely have a 50% survival rate. So if you find someone in stage 1, you save their life.
It's incredible.
It is incredible. I mean, that's huge.
Wow.
My father died when I was 18 of lung cancer, and he died within 1 year of diagnosis. So to find patients at the earliest possible time it saves lives. It really does. It works. It saves lives, and please use it. Try it.
Great. Stephen, thanks so much for talking to us
Zach,
today.
my
It's been
pleasure.
a pleasure. Good luck in the rest of your show.
Thanks a lot, Zach.
All right, this is Zach Kulsrud for Apex 360.